Hello. When it comes to today, I'm going to try to fit into this video just like the medication administration, the use of the PDR, which I do think some of this I kind of did put in my other video, but like I know one of the things is required is the allergy assessment. And I did go over that a little bit, but I'll just to make sure that I did everything. I'm gonna go over that in this video too. So when it comes to medication administration, we always want to do the 3 checks. So we're going to read the EMR, and we're going to check as we're getting it from the drawer. After getting it from the drawer, we're going to check the med label with the EMR again. That would usually be our second check. Sometimes you would also check before pouring the medication. And then number 3, it does depend on the hospital policy, but that's going to be at the bedside. You're going to check the EMR and check the medication, and then you're going to obviously assess the patient and then give the medication. Now, use of the PDR, that is going to be where you can look up the medication before you give that to a patient. That is very, very important. You are always going to want to do that unless it's a medication that you're extremely familiar with, because you have that at your access. So Cal, not right now, honey. I'm doing a video for school. So you have that that you have that at your hands. So you might as well use that so that you make sure that you keep your patient safe. Now, when it comes to drug administration, you're definitely going to want to do your allergy assessment. You're going to want to check the medical history, check their band, and of course, ask the patient. And you always want to assess the patient and know why the patient is receiving their meds. You are going to prepare the medication to be given. You're going to make sure you check all the labels. You're going to want to prepare the injections, observe the proper asepsis technique with the needles and the syringe, and you're going to definitely want to calculate the accurate dose, validate whatever med was given, and then finally you will want to administer that med, and always monitor the patient reaction. And now one of the most important ones is you're going to want to educate the patient, whether you print them out a handout beforehand. You're going to want to educate them, because they of course always have the right to refuse, and if you educate them, then that could help them make their decision as to whether they want to take it, and it'll also help them to prepare for whatever reactions they have.